as early as 30 years old, you should start screening already, especially if you want to get involved in sports, and especially if you have risk of family history of dying early.
There are people who are actively doing marathons,
Oh,
and,
yes,
and
okay.
suddenly they just collapse during the event itself. So could you just
Right, I think, okay, so on that note, that's a bit different. So these are people who've been exercising and suddenly, unfortunately they die. In recent days, at the recent school event, which was a rugby event, and there was one young boy that passed away on the field. Now, the thing is that's why health screening is very important, right? As early as 30 years old, you should start screening already, especially if you want to get involved in sports, and especially if you have risk of family history of dying early, a high risk. Yeah, so that would be something which you have to be careful. And the thing is identifying whether you have any heart pathology. Common things, which is in those that die, sportsmen especially, is when they have their heart muscles are enlarged, right, or we call it HOCM, obstructive cardiomyopathy, right, and also if they've got arrhythmogenic features, which means that they can get arrhythmias easily, right, and these are the people that you would need to do actually some basic tests. Should be able to identify. So we encourage those that want to take up sports or doing rigorous sports that they should be screened.